An Omicron wave is imminent. Globally, Omicron is already fast displacing other variants as the dominant variant. And there have been record high infections in several countries. What is the situation in Singapore now? That brings me to a recent US CDC ruling. It has updated the travel advisory for Singapore to level unknown. And this is because the US CDC is not aware of our surveillance test numbers. So MOH is engaging the US Embassy as well as the US CDC to provide them with the necessary data. Just to be clear, we know our situation very well. Every week, we administer over 150,000 PCR tests, and that works out to over 21,000 PCR tests per day. Positive rates for these tests are under 2%. We also have 155 wastewater testing stations across the island. They are in housing estates, dormitories, nursing homes, etc. Only a very small handful are registering the presence of COVID-19 viral fragments. So we are sure that the incidence of COVID-19 in our community is currently low and stable. But Omicron is already in our community. While community cases are not high currently, Omicron accounts for close to 20% of local cases, and it is a matter of time before it starts to multiply quickly, and we must be prepared for that. So let me talk about our response thus far. When Omicron was first detected in November last year, scientists around the world all grappling to find out more about the variant. And so at that time, we adopted a cautious containment approach. We closed our borders to the affected countries in Africa. We stepped up the frequency of testing for travelers. We isolated infected individuals at NCID. We conducted very active and stringent contact tracing and quarantine around Omicron cases. Those measures helped to delay the introduction of the variant into our community and slowed the local spread. It bought us valuable time to learn about the nature and behavior of Omicron variant so that we can better respond to it. Today, we have reviewed overseas as well as local data with the time that we bought for ourselves, and we are able to clearly map out the characteristics of Omicron. Let me just go through them briefly. First, it is more transmissible than Delta. So we must brace ourselves for a much bigger infection wave from Omicron compared to the Delta variant. For example, at the peak in October and late October and early November last year, we were registering about 3,000 Delta cases a day. Omicron could exceed this by a few times. At its peak, Delta infections were doubling at 6 to 8 days. Omicron infections may double in 2 to 3 days. Second is the silver lining, is that studies coming out of various countries, South Africa, US, UK, Canada, indicate that Omicron infections are less severe than that of Delta. And the data has been very consistent, particularly amongst the vaccinated, and more so amongst those who are boosted. Locally, we have found this to be the case as well. We have so far accumulated 2,252 Omicron cases. Out of the 2,252 cases, 3 required oxygen supplementation, and all have been taken off oxygen within 3 days. So all 3 are now recovering. None has required ICU care as yet. So if these same 2,252 infections had been caused by Delta, based on our experience, we would expect about 30 individuals to require oxygen supplementation, ICU, or die. Third, vaccines, especially boosters, retain substantial protection against severe diseases and hospitalizations for Omicron cases. For example, UK estimated that the effectiveness of vaccines and boosters in preventing hospitalization is 72% and 88%, respectively, for full vaccination and boosters. DMS Kenneth Mark will explain these further. So unlike the last time I was speaking to you here, Omicron is now a better known enemy. We know how it attacks, among whom it is most likely to inflict the greatest harm, and so we can take steps to protect ourselves better, and then ride the Omicron wave as safely as we can.